Antibiotic resistance, the silent global health threat. Understanding the silent invader. Antibiotics have revolutionized medicine and saved countless lives. These powerful tools work by killing bacteria or halting their growth. However, their effectiveness is under serious threat from antibiotic resistance. Antibiotic resistance is the ability of bacteria to survive exposure to antibiotics that would once kill them. Imagine a microscopic battlefield where antibiotics are our weapons. When bacteria evolve to resist these weapons, they become stronger and more difficult to defeat. The infections they cause become harder and sometimes impossible to treat. This resistance affects people of all ages and walks of life. A simple scratch, a routine surgery, or a common infection could become life-threatening. This is not a problem of the future, it is happening right now, and understanding antibiotic resistance is crucial for everyone. How bacteria outsmart medicine. Bacteria possess a remarkable ability to adapt and survive. This evolution, driven by natural selection, is at the heart of antibiotic resistance. Picture a population of bacteria infecting a wound. When exposed to an antibiotic, most of the bacteria will die. However, some bacteria may carry random genetic mutations that enhance their ability to resist the antibiotic's action. These mutations can enable them to inhibit the drug's effects by altering cell wall structures, modifying target sites, producing enzymes that break down the antibiotic, or pumping the drug out of the cell before it can cause harm. These survivors, now resistant to the antibiotic, will reproduce and pass on their resistance genes. With repeated exposure to the same antibiotic, the resistant bacteria become dominant. The once effective drug is now rendered useless against this new resilient population. Fueling the resistance. Every time an antibiotic is used unnecessarily, it creates an opportunity for resistance to develop, and it is driven by a combination of factors. Overuse and misuse of antibiotics are major contributors. A significant factor is the widespread use of antibiotics in agriculture. Farmers often use antibiotics to prevent disease and promote growth in livestock. This practice can lead to the development of resistant bacteria in animals, which can then spread to humans. Poor infection control practices in hospitals also play a role. Hospitals are breeding grounds for bacteria, and inadequate hygiene measures can facilitate the spread of resistant strains. Another critical factor is the lack of new antibiotic development. Developing new antibiotics is costly and time-consuming. Addressing this problem requires reducing unnecessary antibiotic use and improving infection control practices. A grim future beckons. Consequences of inaction. The consequences of inaction in the face of antibiotic resistance are dire. If we fail to address this threat, we risk returning to a pre-antibiotic era, where simple infections could become deadly. Imagine a world where routine surgeries, organ transplants, and cancer treatments are no longer possible due to untreatable infections. The economic costs of antibiotic resistance are staggering. The World Bank estimates that antimicrobial resistance could cause a global economic downturn comparable to the 2008 financial crisis. Healthcare systems will be overwhelmed by the burden of resistant infections. Antibiotic resistance threatens to undo decades of medical advancements, but its most devastating consequence is the human toll, placing millions of lives at risk. The fight against antibiotic resistance is a collective responsibility. It requires a concerted effort from individuals, healthcare professionals, policymakers, and the pharmaceutical industry. One of the most important things we can do is to use antibiotics responsibly. This means taking antibiotics only when prescribed by a doctor and only for bacterial infections. Good hygiene practices are also essential in preventing the spread of infection. Washing our hands regularly, covering our mouths when we cough or sneeze, and staying home when we are sick are simple yet effective ways to reduce transmission. Supporting the development of new antibiotics is another crucial step. Safeguarding our future. Antibiotic resistance is not just a medical problem, it is a societal problem. We must recognize that antibiotics are a precious resource, not to be taken for granted. We need to raise awareness about the threat of antibiotic resistance and the importance of responsible antibiotic use. Education is key to changing behaviors and promoting responsible stewardship of these life-saving drugs. We must act now to protect ourselves, our families, and future generations. By working together, we can turn the tide and safeguard the future of modern medicine. The time for action is now. If you find this useful, hit like, subscribe, and turn on notifications for more expert insights on infection prevention. Stay safe, and I'll see you in the next video.